After a good hand hygiene, sanitize your hand to avoid cross infection. Hi, my name is Mispha. Can I know your name and age, please?
My name is Jyoti, age 26.
Examination of the sensory system. To evaluate the sensory system, you will test several kinds of sensation, pain, temperature. It is related to spinothalamic tracts, position and vibration, posterior columns, light touch, both of these pathways, discriminative sensations. When testing pain, temperature and touch sensation, also compare the distal with the proximal areas of the extremities. For pain, use a sharp safety pin, a broken cotton swab or other suitable tool. Occasionally substitute the blunt end for the point. Ask the patient, is this sharp or dull? After that, discard the pin. For temperature testing is often omitted if pain sensation is normal, but include it if there are sensory devices. Use 2 test tubes filled with hot and cold water. For light touch with a fine wisp of cotton, touch the skin lightly, avoiding pressure. Ask the patient to respond whenever a touch is felt and to compare an area with another. For vibration, use a relatively low-pitched tuning fork of 120 Hz. Tap it on the heel of your hand and place it firmly over a distal interphalangeal joint of the patient's finger, then over the interphalangeal joint of the big toe. Ask what the patient feels. Proprioception grasps the patient's big toe, holding it by its sides between your thumb and index finger, and then pull it away from the other toes. This prevents extraneous tactile stimuli from affecting position. Testing. Demonstrate up and down as you move the patient's toe, clearly upward and downward. Then, with the patient's eye closed, ask for a response of up or down when moving the large toe in a small arc. Repeat several times on each side, avoiding simple alternation of the stimuli. Stereognosis refers to the ability to identify an object by feeling it. Place in the patient's hand a familiar object such as a coin. Normally, a patient will manipulate it skillfully and identify it correctly within 5 seconds. Asking the patient to distinguish heads and tails on a coin is a sensitive test of stereognosis. Number identification or graphsthesia. When motor impairment, arthritis, or other conditions prevent the patient from manipulating an object well enough to identify it, test the ability to identify numbers. 2-point discrimination using the two ends of an open paper clip or the sides of two pins. Touch a finger pad in two places simultaneously. Alternate the double stimulus irregularly with a 1-point touch. Point localization. Briefly touch a point on the patient's skin, then ask the patient to open both eyes and point to the place touched. Normally, a person can do so accurately. This test, together with the test for extinction, is especially useful on the trunk and the legs. Extinction. Simultaneously stimulate corresponding areas on both sides of the body. Ask where the patient feels your touch. Normally, both stimulus are felt. Deep tendon reflexes involves a series of examiner skills. The biceps reflex C5 and C6. Patient in a sitting position, arm should be partially flexed at the elbow with palm down. Place your thumb or finger firmly on the biceps tendon. Strike with the reflex hammer so that the blow is aimed directly through your digit toward the biceps tendon. The triceps reflexes C6, C7. The patient may be sitting or supine. Flex the patient's arm at the elbow with palm toward the body and pull it slightly across the chest. The supinator or brachioradialis reflexes C5, C6. The patient's hand should rest on the abdomen or the lap. The knee reflex L2, L3, L4. The patient may be either sitting or lying down as long as the knee is flexed. Briskly tap the patella tendon just below the patella. Ankle reflex primarily S1.